Good evening, ladies and gentlemen, everyone out there. Welcome to our inaugural webcast. Tonight we have Dr. Barbara Howard talking about, troubles that your children may already be having in school. Before we get to Dr. Howard, I'd just like to let everybody know that we have coming up in November the International CHAD Conference down in Louisiana. More information is available through chad.org, and turn down my laptop volume. My apologies if they're hearing that. You can participate in tonight's discussion by commenting on our YouTube page while we're streaming. We'll be taking a pause every now and then to address comments. We also, you can get to us through our Twitter account. We're at BaltoChad, and you can use the hashtag ChadGBLive. And without further ado, I'd like to introduce Dr. Barbara Howard. Dr. Howard, say hello.
Great. Hi. Good evening. So I'm excited to be here tonight. I also want to let you know that we have a special presentation in October, which is a fundraiser for Greater Baltimore CHAD as well. And you can check our website for more information about that. But I'm not the speaker at that. Dr. Ari Tuckman is the speaker. And tonight, I'm going to be talking to you about something which I assume is near and dear to several of your hearts, which is getting the school year off to a good start. So I'm going to try to share my screen here. There we go. So that is, are you having trouble already? So this webinar was planned for the very end of September, which is when we're all hoping our children have settled nicely into this school year. And some of us will have discovered that that's not going so well. So this seminar is about helping your child with ADHD manage at school. Just to say a little bit more about who I am a developmental behavioral pediatrician. That means I'm a specialist in child behavior and development, and I'm an assistant professor of pediatrics at Johns Hopkins University School of Medicine, as well as a faculty member at MedStar Health, in particular Franklin Square Pediatrics, where I am still seeing patients. So if you want to be in communication with me, you can reach out to me in that way. So the first thing I want to point out is that even if your kid is having trouble in school, and even if your kid is saying they don't want to go to school or they hate school and they're so sorry the summer is over, children want to succeed in school. They really do. And the problems occur when they are thwarted in being able to feel successful. Now, feeling successful and being successful can be two very different things, but they need to feel successful in order to be willing to put forth the effort and take a chance on the potential embarrassment that school entails. So the way I'm going to organize this talk is to think about what stops students with ADHD from feeling successful. Now, by the way, this is not exclusively about ADHD, but I do have a focus on that because, of course, CHAD is specifically for families and with children with ADHD or with adults with ADHD. So the different things that tend to get in the way from with feeling successful in school include how you're doing academically, whether you can control your behavior, how things are going for you socially, whether there are other emotional situations that are playing into it, and what home life is like. So I'm going to go through some of those, starting with academics, because after all, school is supposed to be about learning things, right? So how do you know if your kid is having trouble academically? Well, you haven't had a report card yet. So other things that might point you towards academic trouble include the fact that the child may not be turning in his or her work. They may not be finishing their classwork. They may be bringing part of it home unfinished that should have been finished in class. Sometimes their work may seem illegible or at least messy. They may not be doing well on tests. They may be said to be not participating in class, or it seems like they know what they're doing, but then they can't remember what they learned the day before. And sometimes it gets so bad that kids don't even show up for class, or they come in late for a variety of reasons. So any of those things may point to a child who is struggling academically. But of course, these can also be signs of simple ADHD and its associated executive dysfunction. So you've probably heard about executive dysfunction before, but let me just review what that is. So executive dysfunction is a problem with the executive functions that are supposed to come from the frontal lobes of your brain. And the reason it's called executive dysfunction is because that's the part of the brain that does what the leader of the orchestra or the leader of the company is supposed to be doing, such as dealing with the timing of events. And actually, one could even think about ADHD as being primarily a problem with a sense of time. So what is the problem if you don't have a sense of time? Well, one is you probably don't plan ahead very well because you're not anticipating how much time something will take or when the deadline is going to hit. Second problem with time is that you may have trouble moving from one activity to another. Even if you enjoy both activities, moving from one to another requires you to sort of pull yourself together and move your brain from what you were doing before to what you're doing next. And then the time it takes to complete tasks. So these are very basic problems with timing that tend to be a problem with most kids with ADHD. Now, how does that show up? Well, often it shows up with forgetting to bring their stuff back home from school or forgetting to write down their assignments. They basically run out of time to get those things done because the teacher may start writing the homework on the board, but the child doesn't realize the class is about to end. They're thinking about something else, and so they don't write down their assignments. Sometimes also they have trouble moving things from what's on the board down to their piece of paper. And then often when they're getting ready to leave school, they've forgotten the key books or assignments they need. The next thing, which is very common, that's part of executive dysfunction in ADHD, is the sense that because they don't have a good sense of time, homework looks like a mountain to them. They may have 2 sheets of homework and they say, oh my gosh, I've got so much homework, I don't know where to start. And that's because they don't have a sense of how long it will take. They're thinking about wanting to go out to play or wanting to play their video games. And for them, two sheets of homework seems like it's going to be a huge barrier to those activities. So they may delay starting the homework, or they may not start it at all. So then the parent is in a position of having to help break it down for them and get them started against their protests. Now, there's another part of ADHD that you may or may not have heard of, which is called hyperfocus. So even though kids with ADHD, you think of them as being unfocused, actually it's not as simple as that. Often they are unfocused between tasks, they have trouble changing their focus, and then when they get on the next task, they're overly focused, and it makes it hard for them to finish because they are paying attention to details that are much too small, and they don't finish the tasks. Now, by the way, some of the medications for ADHD can actually make hyperfocus even worse, but that certainly interferes with getting your work done. Another part of ADHD is the tendency to answer impulsively. That can end up showing a short fuse, like a short temper, but it also helps them with the problem of rushing through their work. So they're thinking the work's going to take too long, they're thinking they want to do something else, they start doing it, they answer questions impulsively, sometimes they'll skip problems and not even notice, or they use a much simpler form of language or weak answers. They don't bother giving an elaborate answer to the problem, and all of that can be due to impulsivity. Finally, they are good critics of their own difficulties, and they don't like it. So they don't like the fact that they're messy. They don't like the fact that they didn't finish. They don't like their own mistakes, but they don't know how to stop themselves from doing these things, from making these mistakes. So then they get into a cycle where they tend to deny or cover up. So they deny that they had homework, or they cover up, say, I finished it, or I did it at school, because they don't want to admit that they're not doing all the tasks that school requires. So Finally, disorganization is part of executive dysfunction as well. And even if they get all the work done, sometimes they can't find it in their messy book bag, even in their messy folders, in order to turn it in, so they don't get credit for it. So all of those things are just part of ADHD, even without any other academic difficulties to get in the way. But now let's talk about academics and academic difficulties that are not just part of ADHD. Often they are what's called comorbid with ADHD, and that is a learning disability. So kids with ADHD don't have to have a learning disability. They come in every kind of intelligence, from extremely bright to average to not so bright. Any of those people can have ADHD. But you should know that 35 to 40% of students who have ADHD also have a documentable, they haven't always been documented, but a documentable learning disability. Now, beyond that 35 to 40%, over 60% of students with ADHD underperform compared to their IQ in school. Now, the underperformance relates to what was on that last slide, but learning disabilities are a separate problem that needs separate treatment. Reading disabilities are the most common, and keep in mind also that 4% of kids with ADHD have a speech-language disorder, which interferes with reading, because you basically decode the words and then have to recognize the words as ones you've heard before. That's kind of how reading works. So if you have a speech-language disorder, you haven't been able to appropriately interpret words that you've heard over the course of your life. The kids who are most likely to have learning disabilities are actually those with ADHD inattentive presentation. That means they're not the overly hyperactive ones as much as they are the inattentive ones, the ones who have trouble paying attention and being focused but are not hyperactive. So what exactly is a learning disability? Well, a learning disability is a difference in learning that results in achievement that is significantly less than the child's potential, which is measured by IQ, on standard tests. So a typical definition is at least 15-point difference between what the child's IQ is and how they actually are performing on academic tasks that are tested. It has to be in the absence of a medical reason explaining the learning disability, such as a hearing deficit like deafness, or a lack of exposure to teaching because they haven't been in school or they haven't been in an adequate school. Social factors, such as the fact that they don't speak English as their first language, these things do not count as reasons for learning disabilities. On the other hand, you can have a medical condition, even a condition that causes intellectual disability, such as Down syndrome, and also a learning disability. So it has to be beyond what you'd expect for the medical reason, is basically what I'm saying. And keep in mind, and this is something I have to keep in mind as a physician, that child may have been tested for their vision a year ago, but it can change. So some of the reasons that vision can change in children is something like retinopathy of prematurity. That's for premature babies. The fact that when you go through puberty, your eyeball changes size. You can have retinal detachments or cataracts that develop over time, besides just plain old myopia or getting more nearsighted as time goes on. But it can change pretty rapidly, so we always want to keep that in mind. We don't want to blame it for a learning disability, but we do want to keep it in mind as a possible reason for a sudden change in ability. Same thing with hearing. Get too much wax in your ears, or you have chronic ear infections. That can cause differences in hearing, but so can an infection called cytomegalovirus, or CMV, which can actually cause a progressive sensory neural hearing loss. So if your child had CMV when they were born, and you may know that, but you may not have known that you're not out of the woods. As they get older, they can still develop a hearing deficit. So those are some things to keep in mind. So how can you tell if your child has a learning disability? Well, the basic idea is they do worse than you expect in spite of the opportunity to learn, adequate instruction, and adequate effort on their part. So the only way to really make this diagnosis is to do that kind of psychoeducational testing. That includes an IQ test and an achievement test. And this is a service that is free for you when done by the school. Now, the current recommendations for testing require that you bring in a letter requesting testing. I would recommend you date it and you get somebody at school to sign off that they received it, because they have a limited period of time to respond by doing testing. The new law, however, says that they may do a period of response to intervention first before they do the testing. Now, response to intervention means we're going to try as a school to do all the things we can think of to help your child learn before we'll do testing to see if there's a learning disability. And while I've had mixed feelings about that at various times, I think it's actually a good idea, because those are the things you want them to do to teach them, even if the learning disability is documented, correct? So those things are very important. Now, once you get testing in school, one of the other benefits of doing it that way is that that testing result will be reviewed at the child's IEP meeting in order to make an implementation that includes services in the school. Whereas if you do private testing, first of all, it's expensive, but you might get it done faster. The good things about private testing are that it allows for an independent opinion about whether the child has a learning disability or not. And I know that parents often feel worried about whether the school actually was motivated enough to do testing properly. Now, I believe that they are motivated and that the psychologists are independent agents, but meaning that they will have their own professional opinion about the child having a learning disability or not. But another advantage of having testing done privately, besides getting it done quicker, is that you can request more specific subtests of deficiencies than the standard battery of tests that might be done in the school. So if the school were to do a test and don't find a learning disability, but you still think there is one, or your child's doctor thinks there is one, getting private testing can sometimes sort of hone it down into possible deficiencies that are more specific. So why, you might say, did we not know that our child had a learning disability before? So did somebody miss this? What happened? How come I'm hearing about this now and my kid is in 4th grade or 5th grade or even 7th grade or even high school? Could you see a learning disability then? After all, this is something that's wired into their brain. How come we didn't see it before? Well, learning disabilities may not become apparent until aspects of the work exceed the child's ability. And one of the things I see most commonly is if the student is really bright, that they can get by in school on their general knowledge, even if they're not paying attention, they're not looking at the work, but they know enough to be able to answer questions, and that makes people think everything is going fine. Reading disabilities may not appear to be deficiencies until sight words are no longer enough. So we typically think about 3rd grade as a time when kids suddenly can be diagnosed with a reading disability. Say, well, where was that? They were trying to read for 1st grade and 2nd grade. Well, because if they've been given sight words and they can memorize enough sight words, they can do the work. They won't necessarily stick out as having a reading disability. How about math disabilities? Well, math disabilities may not be stressed until word problems are expected. Again, this is being done at a younger and younger grade level, but typically 3rd or 4th grade, there's a lot of word problems, and that may actually not be a math disability, maybe a reading disability that's getting in the way. But keep in mind that math becomes more abstract as time goes on. So in the beginning, you're just memorizing the pluses and the minuses, right? Addition and subtraction facts. You can even get away with memorizing multiplication and division to a certain extent. But then when you start getting into more complicated combinations of problems, that's when things fall apart for a kid with a math disability. So abstracting abilities may not be required in the early grades. And then suddenly the school is expecting your child to do BCRs. You may or may not know what that stands for. It stands for brief constructed responses. And basically what your child is being expected to do is not only read, but understand and be able to summarize and ask questions for themselves of the stuff they read. And that is a higher level than simply getting the words out of your mouth that correspond to what the words were on the page. Now, there's some other kinds of abstracting abilities that may be present and show up at a later time, such as something called the theory of mind. So children who are on the autism spectrum often do not seem to understand how another person would think about the same thing that they think about. And this may not be stressed until essays that require a point of view are requested. So you may see a theory of mind deficit start to affect work in middle school, even if it wasn't picked up before that. So what can you do about a learning disability? Well, good news, you can do a lot about learning disabilities, although it's not a trivial thing. It's really important. But the main thing to do about a learning disability is to get special instruction. That means by a special educator, somebody who's trained to teach in a variety of ways, not just in one way, but to find a way that works best for this child. That tends to mean that the instruction will be either individual or small group. There may be an aide in the class, or a child with a very serious problem may have a one-on-one aide helping them to understand the work so that they can do it. So special education tends to include multiple modalities of teaching. For example, you ask the child to write it, to hear it, to draw it, to feel it, like drawing in sand or making things, cutting things out of paper, to memorize it using the different channels. So they may be better at one of those sensory channels than others, and using multiple ones help burn it into their brain. So repetition is critical. It's much more important for kids with learning disabilities than for typically developing kids. It requires a lot of repetition. They may have a deficit in memory as well, which is also common in kids with ADHD. Often, in order to be able to provide that repetition and those multiple modalities without wearing the child out, they need to have a reduced workload. That may be a reduced workload in school, as well as a reduced workload of homework, sometimes no homework at all because the child is exhausted by the end of the day. Some things that can help are assigning a work buddy to be able to go over the work with the student. One student is often very able to help another student to absorb things. They can talk about it in a way that really works for their peer. Giving them class notes so that they don't have to take notes in school, or even audio taping while they're in class. There's even software for kids who have reading disabilities, otherwise known as dyslexia, which allows the computer to take a paragraph and read it out loud so that it's going in through their ears instead of having to go in through their eyes of reading it. And for children who have learning disabilities that include dysgraphia or trouble with handwriting, they may benefit from using a word processing like a computer laptop in school as well as at home. And finally, if the school really isn't making enough progress with your child, if you can, you should consider private tutoring. So keep in mind, you have rights. So in the United States, and especially here in Maryland, we have excellent legal protections for children who have learning differences. So if you have a child with a documented learning disability, they should be able to get an IEP, that's an individual educational plan, or if they're younger, preschool children, an individual family service plan, which includes things to help the family as well as things to help the kid. Now, what about a kid who doesn't have a documented LD, learning disability, but is still having significant academic problems? Well, there's another kind of service called a 504 plan, and 504 stands for the public law 504 that covers other health impairments that affect learning. So in order to get this, you don't have to have that psychological testing that I was talking about earlier. All you need is a letter about the medical condition with the diagnosis from the doctor asking for a 504 plan and accommodations, it's called. That means adjusting the educational environment so that the child can learn. You can't get special education with the 504 plan, but you can get a lot of other things. So some of the things that we know can make a big difference to kids with ADHD include having extended time for their testing in particular, but sometimes also for their assignments. Having front and center seating is actually an evidence-based intervention that can make a difference, putting the kid right near the teacher. Now, if the teacher's in the back, it should be back and center seating, of course. Basically, be near the teacher. An FM receiver has also got evidence that it makes a difference. What that means is that the child wears headphones and the teacher wears a microphone, and the microphone is broadcasting the teacher's voice right into the child's ears. That certainly can help reduce distractions. It's a little harder to get the school to agree to that, but it's actually an evidence-based method. Now, some other things that I often recommend to help with some of that executive dysfunction and that I write out in my request for a 504 plan. Now, the parent can do this too, but the doctor has to write the note, but the parent can elaborate on what they think would help, is something like having the teacher have a checklist to sign off on the homework plan. That means they initial the fact that the child wrote down the assignment, the parent initials that the child did the assignment at home, and then the teacher initials that the child turned it in. That can also turn into a very good point chart, where if the child can get 80% of those initials on their work, they would get a prize at the end of the week, or even at the end of the day, depending on how hard they're struggling. So that is a kind of intervention that can be very helpful. Having just one folder where everything that's going to get turned in that day goes into the one folder, or even being allowed to turn in your work at a different time than the other students with prompting from the teacher, because often kids with ADHD, they forget to turn in their work. But you can have a 504 plan that includes the fact that the teacher comes over and asks this child to give them their work, not expecting the child to walk in the line, dropping it in the box at the end of the class. There's a lot of use of Edline here in Maryland, which can be very helpful because then the parent knows what the assignments are. But you can do this without Edline. You can have in the 504 plan that the teacher should actually write down the assignment in the child's book so that they know what it is. So those are some of the things you can do to help with these problems. Okay, any questions so far? Because next I'm going to talk about something else that stops students with ADHD from feeling successful, and that is behavior.
Yes, Dr. Howard, we do have a question. Mr. R is chiming in, wondering what happens if your third grade boy develops a possible OCD and can't engage or learn within the classroom, but was fine the previous year.
Good question. So OCD is obsessive compulsive disorder, and I'm actually going to be talking about emotional problems a little bit more later, but I'm not so much an OCD. So let me take that question right now. OCD can develop apparently suddenly at any time. Actually, there is some evidence that strep infections may bring out OCD, particularly in kids who are vulnerable for that. And when the OCD happens and is interfering with schoolwork, first of all, that does qualify for a 504 plan and accommodations, but it may also be something that should be treated with basically mental health services. So the things we can do for OCD include cognitive behavioral therapy and medication, often a medicine called Zoloft, which can be very, very helpful to OCD. So if this child is having significant OCD, they should see somebody about that specifically and not consider it just a learning problem. That is a significant mental health problem that can be addressed. So I'm glad that you brought that question up, Mr. R. And if you haven't sought out help yet, please do that, either starting with your pediatrician or going to usually a child psychiatrist for that. Any other questions right now, or shall I keep going?
No, right now, please feel free, keep right going.
Great. So the next topic we're going to talk about is behavior. So you all know that ADHD changes the child's behavior, right? Because you're dealing with that at home all the time. So let's just go over the things that define ADHD, because you probably know that there's no blood test for ADHD. There's no brainwave test or CAT scan for ADHD. ADHD is a clinical syndrome. That means it's several features that run together. And those are, the core symptoms are inattention, hyperactivity, and impulsivity. Now, often emotional lability, that means high emotional changes, are also part of ADHD, but they are not required for the diagnosis. So I think it's useful to think of your child that you got a Jack Russell Terrier, not a Labrador Retriever. So anybody who knows about dogs know that the Jack Russell Terriers, those are those cute dogs like the one in the Target advertisement, little white dogs with big brown spots. They are jumping all around, yipping and yapping, dancing around, and they're really fun to have as dogs, but they may not be so fun when it's time for homework. Fortunately, they don't have to do homework. Whereas the Labrador is sitting there waiting for you to give them a pat, and they're patient, and that is not how we would usually characterize kids with ADHD. So the core features of ADHD can be seen in the classroom as bad behavior if it's distracting others. So if a child is inattentive and just daydreaming, that can interfere with their academics, but it's not really something that's causing a problem for the class. And that's one of the reasons that girls who tend to be less hyperactive than boys are, but have nearly equal rates of ADHD, if you look at it closely, they don't come to attention as easily because they're not bothering anybody when they're not paying attention. So instead, more children, even though inattentive ADHD is the most common kind, the other two kinds are hyperactive ADHD and what's called combined type, where you have both inattention and hyperactivity. So a lot of kids have ADHD and they're hyperactive. So they're bringing attention to themselves and causing a problem in the class because they're falling out of their chair, they're asking for bathroom breaks, they're dropping stuff on the floor, they're clowning around, and that's called disruptive from the teacher's point of view. Impulsivity, the third characteristic of ADHD, also can be looked at as bad behavior because these kids are impulsively touching, taking materials to feel them and play with them or tear them up. They may be aggressive with their hands. They may be overly affectionate with their hands, which kids don't like. They may be talking too much. Impulsivity and talking is often the presentation of impulsivity in girls more than boys, but boys do this too. And when they talk, they're not talking about the stuff that the teacher's talking about. So they're off topic because they're talking impulsively, and they may have outbursts as well. So all of these behaviors, while they are part of being a Jack Russell Terrier, they don't fit very well in class. One of the reasons we're all sorry when summer vacation, with its loose structure and no requirement for being calmer than that, is over, and now we have to sit there at that desk for 6 hours a day. Now, let's keep in mind that one of the kinds of behavior that you may have heard about for kids with ADHD is called oppositional defiant disorder. So basically, that means the child is doing the opposite of what they're asked to do. And it may show up as back talk, impulsively talking back, negative talk or a negative response to your request, being defiant, like not even doing the request that the teacher or the parent says. And these things are looked upon as disrespectful behavior, like it's a moral failing. But in fact, these are behaviors that are very common in impulsive kids with ADHD, but they're not inevitable. So even though 65% of kids with oppositional defiant disorder have ADHD, that means most of the kids with oppositional defiant disorder have ADHD. The problem is that teachers and parents and other caregivers may not accept the Jack Russell Terrier style, and they get angrier, more rejecting, more critical. They try punishing. They're doing what they can, what they know, to try to control the behavior, which is actually not really controllable by criticism. So the adults start to think that this child is mean-spirited or immoral, and they just get harder and harder on the kid. And you all know this if your kid has had a teacher who comes on too strong, thinking that they can somehow squash the ADHD out of the kid. So what happens is the child then experiences themselves in a negative way. They're hearing all this criticism, and they can't stop themselves necessarily, but they feel bad about it anyway. At first, at least, they will admit that they feel bad. But eventually, if they get too much criticism, they basically give up. They say, people don't like me the way I am. And then they may even go into payback, where they start doing things vindictively. And that, it seems to be the main way that oppositional defiant disorder evolves. A child with ADHD does not have to go on to oppositional defiant disorder if they can be in a more free-form and accepting kind of setting. By the way, in China, the whole subcontinent of China, there are no children with ADHD, according to the Chinese. And the reason there aren't is that those children who have ADHD are basically sent out to the farm. So they're not in the school situation. So they're not being asked to fit into that sitting in your chair, paying attention all day demands. They're harvesting crops and managing animals and things that you can do quite well with ADHD, but that in the United States, we like to give every kid a chance for a full education, and that means the kids with ADHD are still in the school situation, which is where we want them to be able to be successful. So what can help with these, you might call them ADHD behaviors? Well, first of all, because kids are impulsive and off task, they need closer monitoring, but they need rewards and praise for what they are able to do rather than punishment for being off task. So one of the things I like to do is have the child have a little 3x5 card on their desk, And the teacher, every time they go by and the kid is doing something that's okay in the classroom, doesn't have to be special, just okay, they can put a mark or a smiley on that card. So the child is getting frequent positive input. There's a new app that I've just learned about recently, which I'm really excited about, and you can request this in your school. It's free. It's called Class Dojo. And basically, the teacher walks around with their cell phone, and when the kid is doing the right thing, the teacher pushes a button on the Class Dojo, and it goes ka-ching, rewarding the kid with a sound for doing the right thing. And that report is also available for the parents who can use this system also at home. So if you've never heard about Class Dojo before, look it up and ask your teachers to start using it at school. Some other things you can do, remember, this Jack Russell Terrier needs activity breaks. So this is the kid you should send to the office on the errands or send to the bathroom, or ask them to go to the front of the class and erase the blackboard, doing things that allow them to have a break so they don't have to be sitting quite so long, since that doesn't come naturally to them. They also do better with more participatory learning and teaching. So for example, there are schools where all the kids are learning everything they need from a tablet, which is interactive and it's got little games and media. Well, that's what they love the most, and it's very stimulating and helps maintain their attention and actively engage them so that their tendency to drift off because they have ADHD is being accommodated. We want the adults, that means parents and teachers, to be more flexible and accepting of the child's impulsive behaviors. In fact, these kids are a lot of fun. We should celebrate their enthusiasm. That is really a wonderful thing, but we have to sort of try to constrain it so it fits into the classroom also. Now, there is some evidence that mindfulness training can help mostly the adults who are taking care of kids with ADHD, but somewhat help the kids also. It's not that it makes the ADHD go away, but it helps kids learn to pay attention to where their thoughts are going, and that's what it does for adults. Notice where your thoughts are going. Notice if you're feeling critical of your kid. Let that thought move on. Let a nice and more positive thought enter your mind. Don't judge your thoughts, but don't act on all of them either. And that's actually useful training for dealing with kids as well as for the kids dealing with themselves. Now, let's not forget that the very most effective treatment for ADHD is medication treatment. This is not a talk about medication treatment, but it's something that your pediatrician or a specialist can help with, and it is the most effective of all the things that we're talking about tonight. So if the child is already on medicine, it doesn't mean they're on enough, or it doesn't mean they're on the right one. So keeping in mind that medication is your most powerful tool, please take that into account when you're thinking about these problems for your child. Okay, any questions before I move on to social relationships as something that stops students from feeling successful?
Yes, indeed, Dr. Howard. Stephanie would like to know some recommendations to help de-escalate a situation or to help guide a child with ADHD who winds up spiraling out of control and winds up exhibiting some unacceptably violent behavior.
Very difficult. It's a very difficult thing to deal with, but let me give you some suggestions. So first of all, if we're talking about these behaviors in school, remember that the child starts to lose it because they have ADHD, but then they're also aware that they're embarrassed. So the most important thing is to help avoid embarrassing them. So there's a wonderful author called Ross Greene, Greene, who wrote a book called The Explosive Child. And that book has many very valuable recommendations in it. He also has a website called Lives in the Balance, Lives in the balance.org, I think, that has some good video clips and things to discuss what you're describing, which is basically explosive behavior. And the thing that Dr. Greene would recommend, and I recommend as well, is you have to try to figure out what the gap in skills the child has that throws them over the edge. So they may have a gap in skills at calming down, but they also may have a gap in skills in dealing with frustration. And they need practice on that, but they also need people who understand that that's a weakness for them and will help bail them out so that they don't get overly embarrassed or so that they don't get overly frustrated. Instead, that child may be given like a card, a pink slip that they can have. And when they're starting to lose it, they turn in their card and they can go and take a break without ever having to explain what was going on, because being able to explain it may be beyond their capabilities. They may have a gap in skills for that. So the main ways to deal with children who escalate and get violent is to figure those things out, figure out what is setting them off, what's the gap, and accommodating it. Now, if I could hear you talking, I'll bet the next thing you would say is, well, my child has to learn how to deal with these situations. That's exactly right. They have to learn it eventually, but they got 20 years to do that. They don't have to learn it all right now. So accommodating them now so that they can gain confidence in their ability to cope in those situations is an appropriate thing to do. And oftentimes people start stressing the kid and saying, you should, it's the poisonous S word, you should be able to control yourself by now. You should be able to express yourself verbally. Those things are not shoulds. Those are things that develop in different rates in different kids. And we need to work to understand them and accommodate them until they get those skills to a level where they can handle themselves in those situations. Okay, so I'm going to move on a little bit here into social relationships. So sometimes the reason a child is not doing well in school is because of social difficulties. They have the academic skills, they may have adequate behavior from the adult's point of view, but things just aren't going well with peers. And that's good enough. That's a big enough problem, particularly as you get older, right? School is about peers. The reason school is fun is because of peers. So if things are not going well with peers, it's extremely painful. And the child can either refuse to go to school or get to school and get progressively feel more alienated and will be distracted by their own thoughts about whether they're in or out of the peer group and what people are thinking of them. So social difficulties are a huge problem, and this is true for typically developing kids without ADHD as well. So what are some of the kinds of social mess ups that kids with ADHD have? Well, one is, remember, they're impulsive. So they're touching and they're affectionate when those things are not seen as okay by their peer group. Or they may be touching and pushing when they don't like something a kid does. They use their hands before they use their words. And this is seen as aggression, and it evokes aggression from other kids or evokes punishment from teachers. Their comments and being off topic are not regarded well. So remember, boys are mostly judged by their peer group by whether they can manage things physically, like sports, and girls are mostly judged in their peer group. I know these are stereotypes, but it's still mostly true, by whether they can be engaged verbally. So can they keep up with the repartee? Do they understand about these kind of catty remarks that kids are making? Can they fit into all of that? And children who are speaking impulsively usually can't. They may not be attentive in peer interaction, so they don't notice that somebody didn't like what they were doing because they weren't watching their face. They weren't paying attention to those clues. Or they didn't notice that some other kid had come over and that the rules of the game had suddenly changed. So lack of attention also means that they're not going to be sensitive to some of those peer interactions. They may be oppositional, so they're seen as bossy. And often this comes from low self-esteem. They're not doing too well academically, let's say. They're receiving a lot of criticism, so they give it back by being bossy, and oftentimes they pick on kids smaller than themselves, and that is not seen as attractive by the peer group as well. Now, remember that I mentioned that ADHD frequently includes emotional lability. That means high emotionality, highs and lows. So sometimes very happy and excited and hard to suppress, but sometimes also whining or crying, breaking into tears, pouting, or expressing anxiety or depression. I'm going to talk some more about anxiety and depression in a minute, but people don't expect to see kids in second grade whining and crying. But often the kids who are whining and crying in second grade are kids with ADHD. who have that kind of emotional lability. And now the peer group is thinking that they're babies, right? Remember that bullying is still a problem in schools, and kids with ADHD are both more likely to be bullies and they're more likely to be bullied. So they may not want to tell you about that as their parents. It's hard to get it out of them because what are they afraid of? They're afraid you're going to intervene, and that's going to make it worse because they won't have a chance to work it out on their own, and you may embarrass them further. But it's important to know that because it can have serious emotional consequences. Children with ADHD often have something called developmental coordination disorder, meaning they're kind of awkward. So they may not be as good at sports. You'd think a hyperactive kid would be good at sports, but they're not always good at sports because they may not have smooth motor coordination, or they may have great motor coordination, but they can't pay attention to the rules. And so they're impulsive on the sports field, or they're not paying attention to the coach. And that means they're not as successful at sports, which means they may get sidelined or rejected by peers. And every kid needs to have some asset that earns them a place with their peer group. So finding that asset is really important. So what can you do about some of these social difficulties with a kid with ADHD? Well, first of all, treat the ADHD. Don't forget to treat the ADHD itself, as I mentioned before, and any comorbid conditions, which I'm going to talk about again a little bit more in a minute. Listen to the child and their suffering and try to problem solve specific examples of where things went wrong with them socially. And then role play alternatives. You can play the role of the other kid, or you can play the role of this child, and your child can play the role of the kid that was bothering them, so that you can show alternative ways that they might have handled that situation. There's a wonderful kind of intervention called social stories, and this is something that is used a lot for kids on the autism spectrum, but I actually recommend it for kids who are not on the autism spectrum also. It can be good for all kids who are having social difficulties. Basically, you lay out a scenario and then you work through it almost like homework. Practice it and build the social stories on how it's going to come out. That means the child will have already rehearsed how to handle certain situations before they come up the next time, if not before they come up the first time. So how do we help a kid get some friends? Well, I suggest that the parents have the kid invite over somebody in their class for a no-fail play date. So what is a no-fail play date? Because you all know that sometimes a kid comes over and after about an hour, they want to go home because your kid is being too bossy or something else. So a no-fail play date is one that's going to come out great no matter what. Bowling is a good example. Going to a movie and buying popcorn is a good example of something that will then give your child an atmosphere, a reputation, at least with that one kid. Oh, this is a good kid. I had fun when I was with this kid. They don't actually realize that the reason they had fun was because of the movie, not because of the kid, but it carries over so that they'll have a more positive attitude towards your child at school. You want to be sure to foster some kind of strength building activities outside of school, especially so that the child can feel good about themselves. And also that often is a way to find a positive peer group. So where do you get a positive peer group if you don't have one for your kid in school? Well, church groups are good for that. Scouts are good for that. Other kinds of activities, tennis lessons, for example, or singing groups. Volunteering is a wonderful thing to do. And when the children are under 13, the volunteering may have to be with the family as a whole. But as they get older, they can volunteer on their own. And that is a huge thing to build their self-esteem, to give them people who appreciate them, and often to build job skills as well, which is not a small matter these days, especially. Often the teacher can give suggestions or help out on helping a child manage socially. So maybe by talking to the teacher can say, yeah, you know, your child always has trouble with this one other kid. Why don't I move their seat across the room? And so brainstorming with the teacher on ways to help the kid be with others who might be more positive about the child is all good. Many schools will have social skills groups. You have to be a little careful about that because sometimes social skills groups mean this is for kids who are aggressive, and you may not want your kid in that social skills group. So find out who's going to be in the social skills group. But it's a good way for kids to practice skills with a grown-up who's monitoring them. Don't expect that you're going to be able to solve all this for your child, and don't try to. It turns out that parents who are too intrusive in children who have social skills deficits actually can make matters worse. So you can help practice at home, but don't get too involved in the school or badmouth what's happening at the school, because then the child will pick up on your attitude about that. Okay, let's see. We've got 12 minutes left. I got 2 more topic areas, so maybe I'm going to sort of skip questions at this point and move on to emotional problems. I hope I'll still have some time for questions at the end. So I mentioned that ADHD often has comorbid learning disabilities, but it's also common for other conditions to be more likely to occur if you already have an ADHD diagnosis. And this is undoubtedly a genetic combination. So in other words, it's a genetic reason for the ADHD, and it's also a genetic reason for the anxiety or depression. But it's important to recognize this, and you may not see this initially. So here's, like at younger ages, you may not appreciate that those things are there, and they probably aren't there in the beginning. So this is a table of conditions that are comorbid with ADHD. I already mentioned oppositional defiant disorder. Conduct disorder is a worse form of that, where there's really antisocial behaviors. Anxiety disorders occur in 21% of kids with ADHD, depression in 18%. As I mentioned, learning disorders narrowly defined in this case in 12%, school underachievement 60%, and language disorders 4%. Now notice that those the oppositional and conduct are more common in the hyperactive, intensive, impulsive type of ADHD or the combined type, whereas anxiety disorders and depression and learning disabilities are more common in the inattentive or combined types. So let's talk first about anxiety and ADHD. Well, one important thing to know is that a child with anxiety may look like they have ADHD, but actually the only thing they have is anxiety. In other words, it's been mistaken for ADHD. So that's important to keep in mind. So if you think your child has anxiety, be sure to bring this to the attention of your child's doctor and ask about that, whether the anxiety could be explaining the inattentive symptoms. When children have one anxiety disorder, they're quite likely to have more than one. Most of them, in fact, have more than one. So it's good to know about the different kinds, and this has several of the kinds right here on this slide. So in separation anxiety, children have trouble separating from their primary caregivers, and that may cause them to have school refusal or difficulty getting out the door in the morning, or physical complaints, especially Sunday night, or distractibility because they're thinking about their parents, thinking about being home when they're at school, and they should be thinking about school. Generalized anxiety disorder is more general anxiety for different things. So they may have fear of embarrassment, they may be afraid of loud teachers or fire drills or the lunchroom. Social anxiety is fear of social situations with peers, so they may not speak out in front of their peers, and they may have trouble in groups. Selective mutism means that they can't talk in school at all, and even though they may talk just fine at home, that's a form of anxiety as well. Obsessive compulsive disorder, we already started to review. And the way it can affect school is they can't finish their work because it's not perfect, or they have to perform some kind of ritual, either a real ritual or ritual in their head, in order to get started. Often kids with OCD get in trouble with their peers also because they're correcting their peers for things that their peer may be doing wrong in the mind of the child. And even if it is really that they are doing something wrong, the kids don't appreciate being corrected. And finally, we got to remember Tourette syndrome, which may present as ADHD, but then later develop the tics and the vocalizations that make for the diagnosis. These kids generally have inattention, hyperactivity, and anxiety as well. Now, how about depression? So depression is the other most common comorbid condition with ADHD, and it may be what's called intrinsic depression or reactive depression. So intrinsic means there's no good reason that we know of for the child to be depressed, but they're depressed. Reactive depression means something happened that made the child unhappy, and they don't bounce back the way you would expect. So oftentimes children with depression, and this is true whether you have ADHD or not, start out with anxiety, and then over a period of years, it evolves into depression. And this is typically inherited, but it can also be modeled or reinforced by an anxious parent. So the parent has anxiety too, and so when the child shows anxiety, they then focus on it more instead of helping it get better. So depression can look like daydreaming or fatigue or low work output, not finishing the work and not appearing to care about it. They may complain about being bored or forgetful, and depression can affect cognitive functioning as well. Depression can also present as aggressive, irritable behavior or sassiness, especially in teenagers. So keep those things in mind that depression may be emerging. So how do you know if your child has anxiety or depression? Well, it can be hard to tell. These are called internalizing disorders. So in other words, they're not acting bad, but there's something wrong inside of them, and they seem okay mostly, but the child may not actually say, you know, I'm sad, or you know, I'm nervous. They may not recognize that they are, or they may just not want to admit it, so they underreport symptoms. So first of all, you have to ask the child for specific examples of how they feel and how much of the time they feel sad or how much of the time they feel worried. Often asking teachers or other adults who know the child if they've seen any signs of anxiety or depression can be very helpful. And there are screening tools. I don't mean blood tests. I mean questionnaires that people can fill out online or on paper that they can be provided by the doctor. And that's a very valuable way of helping to see if this child is beyond the normal range in their anxiety or depression. Because we all have some anxiety and some depression, right? The question is it beyond the typical? So what can you do if you have a child with anxiety or depression? Well, talk about it with the child, read about it for yourself, learn about these conditions, and be supportive of the child. Don't blame them for feeling that way or criticize them. Make sure that you've assured a healthy environment for them of enough sleep, enough healthy food, and enough exercise. These things have been shown in mild to moderate depression to be almost as good as medicine. So not quite as good as medicine, but almost as good in the milder forms of depression. Watch out for the use of the media. The media includes bad things happening, and watch out for bullies on the media or in person. Ask the school if they can provide some counseling for these problems, or get a referral for cognitive behavior therapy by a psychologist or social worker. Those are the kinds of people who do this therapy, and this kind of therapy tends to be equally effective to medications. But medications such as Prozac or Zoloft can also be helpful to kids who have either kind of problem. Okay, I got 5 more minutes. I'm going to have to speed it up here a little bit. Let's talk about the final topic, which is the child's home life. How can the child's home life make them not feel successful in school? Well, here's what we know, and that is the key to success in school is parent commitment to education. And the way it tends to come out is parents who set good routines for homework, going to bed and getting up, who show interest in the child's work, who provide praise, but also monitoring or assisting with homework, going to PTA meetings and being involved in the school, perhaps by volunteering, but certainly by paying attention and meeting with the teacher at those regular times. Looking studious yourself, for example, reading when the child is present, so the child knows that you value reading, and pursuing a career or at least activities that require education make the child value education more. And those things have been shown to be associated with better outcome in school, regardless of IQ. So how can things go wrong? What are some of the home factors that can affect school? Well, if the parent doesn't provide enough structure, they may not, if they show no expectations for doing well academically, or have low expectations for what the child should do in terms of being careful about doing their homework and being careful about preparing for tests and getting decent grades. If they have poor models of behavior or ineffective management when the child's behavior is out of line, so the parents themselves are not showing respectful behavior or showing under control behavior. And lack of warmth and affection can all affect a child's school performance. So a parent who is punitive and taking a rejecting approach when the child's doing badly in school, or families who are simply stressed out by economic factors, work factors, marital discord, or just overextended by having too much work to do. Having a mental illness in the family can have an effect on everybody, genetically, as well as just through the stress of having a mentally ill person in the family. And of course, substance use, or the worst case scenario is when there's domestic violence or abuse of the adults or of the children in the home. Those are all extremely serious situations. So what can you do about these things? Well, if there are home life problems affecting your child's ability to function in school, you should do something. You should take action for the child's sake, if not for your own sake. You know, it seems overwhelming, especially if you're in that stress category. Start small. Start by just asking about the child's homework. Maybe you can cut back on one thing in order to be more available. Turn the TV off so there's silence in the house so that the conversation about school can occur. Set a structure. That means same bedtime every night, limiting media, preferably no media, no screen time on weeknights is the very best. Making a set time for homework, a set time to wake up, enough time to get meals. All those things are things that are in your control. Even if you have a stressed life or you're living in poverty, you can set a structure. Think about going beyond your past. If you were not good in school, that doesn't mean your child can't be good in school. Have an expectation that things can be better. If you're having trouble supervising your child's homework or don't feel like you can help with the homework, trade services. Maybe you can babysit the neighbor's kids so the neighbor can supervise your kid's homework. They may be grateful for the break from their babies, and your kid is grateful to have somebody who knows how to help them with algebra. And don't forget, you can get counseling for mental health, substance, or domestic problems in your own home. Well, it's 9 o'clock now. I don't think we have any time for any more questions, but I really appreciate the attention that you've shown, at least as far as I can tell from the questions. And I hope this will be useful to you. It will be available on the website. Rob, maybe you can say something about that.
Yes, thank you, Dr. Howard, for the presentation tonight. And thank you, all of our guests, for the questions and for watching. Just a couple of final notes. On October 18th, Dr. Ari Tuckman is going to be giving a presentation and a talk on excuse me, change what you can and accept the rest. In November 12th through the 14th, Chad's next international conference is going to be down in New Orleans. So I hope we see everyone there for that. And please visit chad-mc.org. Find out more information about support groups in the greater Baltimore area, groups for parents, for caregivers, for parents of adults with ADHD and adults with ADHD and some of their spouses. And we also have listed out some of these special upcoming events. We're going to be kicking off our next parent-to-parent training class, providing education, information, and support in a small setting that's going to be starting this upcoming Sunday, October the 4th. And again, I want to thank everybody for watching. Thank you, Dr. Howard, and thank you everyone for submitting questions. And I want to wish everybody a wonderful evening.